Welcome to the Geriatric Dietitian, your go-to resource for nutrition that supports health, independence, and confidence in aging. I'm your host, Katie Dodd, registered dietitian and geriatric nutrition expert. Let's dive in. Hello and welcome to the 16th episode of the Geriatric Dietitian Podcast, Poor Oral Health, Malnutrition, and Aspiration Pneumonia. Now, we have been doing a series on the podcast all about oral health, why it matters. We've talked about oral health in general, dry mouth, the challenges that come from missing teeth and dentures. And today we're going to talk about something that I believe is one of the most important reasons on why oral health deserves more attention. Poor oral health isn't just about cavities. It isn't just about losing teeth. It isn't just about having bad breath. For older adults, poor oral health can literally become a matter of life and death. And I know that can sound a little bit dramatic, but this is why I wrote a whole blog article on my website, The Geriatric Dietitian, about older adults and dental care and oral health. Because we know that poor oral health can contribute to pain, which makes eating difficult, which leads to weight loss, which leads to muscle loss, which can increase risk of falling, hospitalization, premature death. It can contribute to disease. It can affect social relationships and ultimately have a serious impact on health and quality of life. So as a geriatric dietitian, there are two complications that I think about more than any others when it comes to poor oral health. The first is malnutrition. The second is aspiration pneumonia. So that's what we'll be talking about on today's episode. And we're going to start with malnutrition. So malnutrition occurs when the body doesn't receive the nutrition it needs. For the most part, calories, protein, what we need to preserve muscle mass. Over time, if we don't get enough nutrition, this leads to loss of muscle and body fat, reduced strength, decreased independence, weaker bones, weaker immune system, more hospitalization, and poorer overall health. Unfortunately, malnutrition is incredibly common in older adults. This is one of the main focus of my blog, The Geriatric Dietitian, trying to stop unintended weight loss, trying to stop malnutrition, trying to preserve independence as we age. Now, research has found that rates vary depending on where someone lives, whether they have malnutrition or not. So when we look at the data of how many older adults have malnutrition, it's hard just to say a specific number because so much of it depends. We've talked about this on the podcast before. An older adult is someone age 65 to end of life. That is a very broad range. You could be on the younger side of that range and very, very sick. You could be on the higher side of that range and extremely healthy. It's very, very broad. But it is estimated that malnutrition affects between 1 and 15% of older adults who live independently, meaning they're not getting any support to live. 25 to 60% of those who live in geriatric care facilities have malnutrition, and as many as 35 to 65% of hospitalized older adults have malnutrition. So very, very important. I will be doing plenty of podcast episodes in the future all about malnutrition and muscle health in older adults. So all that to say, what does oral health have to do with malnutrition? Quite a bit. If someone has pain in their mouth because of untreated dental problems, if they lose teeth, we talked about occlusion, having teeth on the top and the bottom, and you need those two teeth in order to chew. And even if you're just missing sporadic teeth, or if you have pain in those teeth, it makes it real hard to chew. If your dentures don't fit properly, if your dentures maybe you don't have them anymore. If you have dry mouth, which is causing, eating to be difficult, if chewing hurts, you're probably going to eat less. And when you do eat less, you start avoiding certain foods. And maybe you stop eating meat. You stop eating high protein foods. You stop eating high calorie foods because they're difficult to chew. Maybe raw fruits and vegetables disappear from your plate. Maybe nuts feel impossible. And over time, the amount of food consumed just continues to get smaller and smaller. And with that leads to unintended weight loss without intention, because we know without enough calories and protein, weight loss and malnutrition will follow. So this is one of the reasons why oral health is considered a risk factor for malnutrition, because the mouth is the first route of nutrition. And if there's problems with the mouth, it's going to have that trickle-down effect to lead to malnutrition. So as dietitians, especially geriatric dietitians, we spend a lot of time asking about appetite and weight loss, but also we ask about the mouth. We ask about oral health. Does it hurt to eat? Have you stopped eating certain foods? How are your dentures fitting? Are there foods that you've given up on because they're difficult to chew? So these are some questions we might use to uncover nutrition problems that might otherwise go unnoticed. So the next issue that can pop up in addition to malnutrition with poor oral health is aspiration pneumonia. So aspiration pneumonia, and this is essentially when we swallow food, it should go down the esophagus, right? But if it accidentally goes into the windpipe and gets into the lungs and bacteria infection, you go into the hospital with aspiration pneumonia. You've aspirated something into your lungs that shouldn't be there. So aspiration pneumonia is when the food or liquid or even saliva enters the lung instead of the stomach. And we see this more often in older adults with dysphagia or difficulty swallowing. They are at the highest risk. We know that 15% of older adults have dysphagia, and aspiration pneumonia can lead to hospitalization, disability, malnutrition, and even premature death. So here's the part that surprises people. If you have dysphagia, we always recommend that you see a speech language pathologist. You get a swallow study done. They recommend the safest diet for you, so you might be on a modified diet. And even if you're following all of the recommendations perfectly, even if you're eating the correct texture, a modified diet, even if you're doing your swallowing exercises, everything right, someone can still develop aspiration pneumonia. Why? Saliva. We often don't think about this, but we swallow our saliva all day long, right? We don't even think about it. It's just the subconscious thing that we have saliva going down our mouth. And if someone has poor oral hygiene, bacteria can build up in their mouth. And if you have bacteria-filled saliva that accidentally goes down and is aspirated into the lungs, it can contribute to aspiration pneumonia. And this is why good oral hygiene plays such an important role in dysphagia management. This is why regular cleanings and keeping the mouth healthy is so important as even a step to prevent aspiration pneumonia, especially those with dysphagia. So research has shown that regular oral care, including cleaning of the teeth, the gums, dentures, can reduce the risk of aspiration pneumonia, which is really amazing if you think about it, right? So brushing someone's teeth isn't just about preventing cavities. It can also prevent serious, potentially life-threatening infections like aspiration pneumonia. So the conversation we've been having with the series, it's more than just our mouth, right? Poor oral health can affect so many things. And we did touch on this in the last episode, and I want to bring it up again because poor oral health can affect emotional well-being. It can cause pain. It can cause embarrassment, difficulty eating in front of other people, missing teeth, bad breath, inflamed gums, things that can affect confidence, relationships, and quality of life. Some older adults begin avoiding social situations because eating has become uncomfortable or embarrassing. Others simply lose interest in food because everything they eat, every meal, it just becomes a struggle. And when this happens, nutrition often declines even further. So what do we do about this? So as healthcare professionals, as caregivers, we have an opportunity to make a difference. And if you are listening to this or watching this video on YouTube and you're an older adult yourself, sometimes just the awareness makes all the difference to realize like, oh my gosh, I never connected these puzzle pieces. So we need to be talking more about oral health. We need to be looking inside the mouth. We need to ask about chewing, ask about pain, ask about like when's the last time you saw a dentist, got your teeth cleaned, got an x-ray done? Are you brushing? Are you flossing? Let's make sure we add this into our daily habit. Supporting regular dental visits whenever possible. I do recognize that dental insurance can be hard to come by. Dental care is expensive, but the cost on the other end is so much more expensive. Going to the hospital, and not just the monetary costs, but the cost to our health, the cost to our emotional well-being. There's a lot of costs behind it. So if oral health concerns are identified, we need to make sure we are making referrals to dental professionals, connecting with community resources if finances are a barrier, because lots of communities have special programs available, even special clinics that can provide support and services to people who have limited finances. So kind of wrapping things up, we know that small conversations can have tremendous impacts on people's health. And our biggest takeaway from today's episode is that poor oral health isn't just a dental issue. It's a nutrition issue. It's a quality of life issue. And sometimes it could even be a life or death issue. By recognizing oral health concerns early, we can help older adults maintain better nutrition, reduce the risk of malnutrition, and potentially even reduce risk of aspiration pneumonia. So thank you so much for listening to today's episode on the Geriatric Dietitian Podcast. We do have one more episode in our series on oral health. I mean, I'm sure over the duration of the podcast, I'm going to continue to sprinkle it in, but I hope that you are finding this series and this podcast valuable. Be sure to subscribe, share the podcast with a friend, and I will see you next week on the Geriatric Dietitian Podcast. Want simple nutrition tips to support healthy aging? Download my free guide, 10 Essential Nutrition Tips for Healthy Aging, packed with practical ways to stay strong, nourished, and independent as you age. Grab your free copy in the show notes or visit thegeriatricdietitian.com.